Oh, I just start?
No, oh, let me tell you that. I just started it, but I'm going to let it run and I'll chop this off. So I'll do an introduction, and,
Okay.
and then I'll introduce you. And then after you kind of respond to my greeting, then I'll come back and ask you the first question.
Okay.
Okay?
Yes.
All right. Hi, I'm Carol Bell, and welcome to this episode of Strategic Solutions TV. Today we'll be discussing a topic that's really important to a lot of people, and that is how do you find a good cosmetic dentist when you're looking for one online. And today I have a really important guest with me that's going to help us with that. It's Dr. Bradley Markowski from Clive, Iowa. Dr. Markowski, welcome to our program today. How are you?
I'm doing great. How are you?
I'm wonderful, thank you. Dr. Markowski, we know that a lot of people go online, especially people that are in Clive or Urbandale, Waukee, West Des Moines, in the Iowa area. And when they are looking for a good cosmetic dentist, when they search online, there's so many dentists to choose from. So what kind of advice do you have for us today as to what kinds of things you think are important for someone to look for when they're looking for a good cosmetic dentist?
Well, first I'd like to maybe start off with what not to do. And dental insurance, if you're fortunate enough to have dental insurance is certainly changing. It's changing a lot over the last several years. And maybe the one thing that people get caught up in that isn't necessarily something, or is something that can lead them in the wrong direction, is looking at their preferred provider list and staying just with people that are on their preferred provider list. Some insurances are very good and have very nice benefits and have a lot of preferred providers on them. But some insurances do not, and there's a reason that they do not have a lot of preferred providers. Their benefits to the doctor are low. The benefits to the patient are usually low. And this can cause a problem. People tend to look at their names in the list and say, I got to go to one of these people. And that is not true. Normally, the vast majority of these insurances will pay out benefits to any dentist that you choose. It's just that the dentists on the preferred provider list agree to take a large cut in fee in order to have those patients. So, you know, there are not any dentists out there, or very few dentists out there, who don't join the preferred provider list because they don't want any patients. They just don't join the list because the benefits are so low that they will not be able to perform the dentistry that they want at the level that they would want. Basically, corners would have to be cut, different, lesser expensive and lesser materials used, less time in the chair. For instance, you know, if your dental cleaning is done in 20 minutes, some corners are being cut. So keep these things in mind. Any dentist can claim benefits from that insurance company. Yeah, there might be a little bit of extra money left over that the patient will have to cover, but it's well worth it in the big picture, especially when you're considering something like cosmetics, which do take the most expensive materials, the most expensive equipment to achieve proper results. One other thing that you might want to, yeah, you can talk to friends, coworkers, neighbors about dentists, and they will certainly share with you good experiences that they've had with dentists. But simple observation is also good. You can go up to any dental office, and if it's new, it's no guarantee of quality care. But if you see a relatively new office with new equipment and a good, happy staff that works hard, you can pretty much guarantee that you're on the right track and you can get some nice quality care at these places.
Good. So do you think that when they're looking online, should they look at reviews or check out a website to get an indication of where they might want to start?
Certainly, reviews are huge. You're not going to have a dentist who is not proficient with certain procedures, whether it's cosmetic or implants or some of the more advanced procedures, you're not going to see these patients getting a whole bunch of positive reviews about those procedures. Okay, so you're not going to see someone who is inexperienced at, say, cosmetic dentistry, implant dentistry, getting a bunch of positive reviews for just those procedures. So yes, reviews can certainly tell you where, how patients have been satisfied with those procedures, and those are present online in several different areas, whether it's Google or Yahoo or Angie's List or whatever. There's plenty of places to go look for that type of review.
Great. So that's really great advice. I didn't know that about the insurance situation, and I'm sure for most people that are watching this, that may be new to them too also. So that's great to know that they really can choose who they want to go to. They don't have to be stuck with just the list that's provided to them. So that's
right.
Great.
Correct. You may be led to believe that these are the people that they, it doesn't really make that much of a difference to the insurance company because they're still paying out the same amount of money. But they want you to go to the preferred providers if possible. But that's just, it's not written in the law, in the rules of most of these policies. So you can still get that benefit from your insurance. If you don't have insurance, you're certainly more free to look around, and you've got several other options, including the online reviews, including just, like I say, personal observation, friends, neighbors, referrals, and whatnot.
Right. Good to know. So, Dr. Markowski, what do you think makes your practice unique and different from all the other dentists in that West Des Moines, Clive area? And what can someone expect to have? What kind of experience can someone expect to have when they do come in to see you?
I would say that when you come to our office, you're going to get a complete and thorough care. And whether that means that you're coming here to get extensive dental care, which would involve the entire team, or whether you're coming here, like quite honestly, the vast majority of people that are coming here for continual care, and that would mean 6 months visits to the hygienist with exams. Our team is extremely thorough. You could expect a thorough hard and soft tissue oral exam along with a oral cancer screening. We will, when patients have a specific dental problem, we'll address that. We'll discuss different options for dealing with that problem, whether it's cosmetics. We used to have mainly the only answer was always dental veneers or porcelain veneers, and now there are several other options, and our patients tend to be a little happier with several other options instead of just cutting teeth and putting on dental veneers. Now we're using Invisalign to straighten teeth. Invisalign's a system of aligners, clear aligners that are basically invisible on your teeth and serve like braces, although they work a lot faster than braces. And for adults especially, this is important. They want to get a treatment started and finished. And just with a little extra patience with Invisalign, we can straighten teeth and we can repair chips and end up with a better result than traditional veneers. Sometimes veneers are the best and only option. There's still definitely a place for veneers, and we use them quite a bit, but we do try to be more conservative in our treatments. We try not to cut down teeth when we do not need to cut down teeth, and if that means straightening them and just repairing small edges with cosmetic bonding, we use the best and most advanced bonding available, and we can usually get a much better result if both options are available. We have 4 hygienists here. They are all very well continually trained, and besides being a advanced practice in cosmetics, advanced practice in in implant dentistry. We do implants to replace single teeth, several teeth, all teeth, and these are the things that we pride ourselves in, that we're constantly getting continuing education on. And besides that, we're also a family dental practice. We have, like I say, 4 hygienists, and it's not uncommon to see a mom in one chair and the 3 children in the other chairs next to them, and getting all their treatment done at one time. So instead of mom coming in with the kids and having a 3-4 hour dental visit, they're all done in about an hour. And this is not only convenient, but it's easy to do for us. It's not an issue at all. And these people are not people that we're seeing in a constant basis to do treatment on. That's why we pride ourselves in our family practice, and that we can, when people come in here, like I said, the majority of people come in here don't need a lot of work, and our job is to keep it that way and to make sure that they can continue not to need a lot of work.
That sounds great. And I know you've been in business for 20 years, so you are truly an expert in your craft, and you do continuing education as well, so that you're always updated on whatever a patient may need for their situation.
Yes, and it's an ongoing
learning process, right?
Well, it's an ongoing learning process, correct. It's an ongoing thing where we're like, for instance, 15, 20 years ago when I started, we didn't have a lot of options for implants. I mean, they were just getting started, and people lost teeth. We were reducing other teeth to put bridges in. We were making removable dentures, and these are things that people tolerated because they had to. We didn't have all the other options. Right. And over the past 20 years, continuing education, whether it's on implants, whether it's on cosmetics, whether it's on something like Invisalign, this keeps us up to date and keeps us, or allows us to offer the patient that much more. When they do come in and they do have these situations where we have to do a lot of care, everyone's given a treatment plan. Everyone is explained several options. So each treatment plan may have 2 or 3 different options on it with costs and the approximate time that it might take to finish these treatments. We like to make sure that our patients don't have any surprises.
Right. That sounds great. So Dr. Markowski, if someone is interested in coming in to consult with you or to come in and see your office, what's the best way for people to contact you?
Well, still the best way is by phone. And our phone number is area code 515-987-7670. This way, we can have our staff talk to you and find out exactly what the situation is, so we can have you properly scheduled. We can also have a scheduling done online at our website, and that is Markowski DDS.com. But it seems to be better over the phone, because that way the staff can appoint you in the proper position. If you need immediate dental care, the appointment will be just with myself. And if it's something more like a general cleaning or a initial diagnosis of a problem, we'll probably have you set up with a hygienist schedule, get X-rays, get a nice cleaning, and then I will come in afterwards and discuss any issues, any problems. And you can expect to be here for a full hour on those days. And our cleanings are very thorough, and they will last anywhere between 45 minutes and an hour.
Good to know. Dr. Markowski, this has been such great information. I really appreciate the time you have taken to be with us today and share this information with us.
Well, thanks for talking. I appreciate it.
You're welcome. And thank you, everyone, for watching. If you're in the Clive, West Des Moines area, Urbandale, Waukee, call Berkshire Dental, Dr. Markowski at Berkshire Dental. He's an experienced dentist, and he will work with you to determine exactly what treatment that you need for your needs. So thanks for watching, everyone. We really appreciate you being here, and we'll see you next time.